All right, everybody, welcome to another episode of the Blend Blazers podcast with your host, Ricardo D. Rice. You know that in this new space, we're talking to unconventional leaders who are carving out and making a niche in their area. And today I am so honored because y'all know I call them hometown heroes, meaning people that are from my hometown, which is cow tipping, deer hunting, one stoplight towns, that we clawed our way out of and kind of made these spaces. And today I am so excited. All right, so I call her Denise, but I'm gonna let her say her real official name when she introduces herself. But like I said, I call her Denise, and today we are looking at a Black female scientist. She's like a unicorn. I'm so excited right now. She's like a unicorn, and I'm so honored to actually know somebody in this field of science because we talk about STEM all the time, and to finally be able to pull somebody in the science space means a lot. So I'm gonna let her introduce herself, and we're gonna take it from there.
Okay, thank you so much, Ricardo, for having me. And like you said, my name is Coletta Denise Orr. I am a breast and ovarian cancer research scientist. I'm an author. I'm a speaker. I'm a community change agent. I'm all of those things. So yeah, that's who I am.
All right, so y'all don't have to tell the anecdote when it's people that I know. So me and Denise met each other in gotta be 1999 to 2000 because that's when I came to Tommy, and we were working at Tommy Hilfiger in the outlets in Bluffton, and you see this pretty girl with this like meek personality that you just kind of love, and that's how she was. She had like this meek personality, pretty girl, she just kind of did her job, and then you had some fun, and this really I think you left like it wasn't long after I got there. It was like 2 or 3 months later you were gone. Yeah. And that's when the train went off the rails, but I digress. All right, so let's start at the beginning. So tell me about educationally, how this began. I know you went to Voorhees, so tell me about what you majored in, what kind of introduced you to this field?
Okay, when I went to Voorhees College, like you said, with undergrad, I did a double major in biology and chemistry. And from there, I did internships. So I got my feet wet in doing like bench research when I was in undergrad. And what sparked my interest is because my grandmother passed away from ovarian cancer. So I was interested in learning more about the disease. I knew, we've all heard of breast cancer, of course, but ovarian cancer is a more rare form of disease that is gender specific, for women only. And I just wanted to learn more about the disease. And, in undergrad, I tried my hand at it. I was pretty good at it. And I was able to get an internship at Georgetown University in Washington, D.C., and that's where I am now. That's how I ended up in D.C., coming to Georgetown School of Medicine, got my hands trained, went to the National Cancer Institute, the National Institutes of Health, and right now I'm working for Merck Pharmaceuticals, where I work in drug development. So that's where I am.
Georgetown, okay. The internship space, because we have this conversation a lot, are they vital or are they optional? For you, how much of a difference did having an internship make, and where were you for your internships? Where were some of your internships?
Okay, I did one internship at Meharry in Nashville. I did another internship at Georgetown University. I think it's very important if you want to pursue a career in science, because most principal investigators, those are the leaders of the labs. They own the lab. They want somebody whose hands are already trained. They don't want to come in there, it's a lot of money on the line. It's a lot of federal dollars on the line when you're doing cancer research. So they don't want anybody in there like playing a trial and error. They want you to at least have some type of concept of what you're doing. So I think it's always good to be able to have some type of training on the undergraduate level. A summer internship, or working in the lab while you're on campus with your like biology teacher or chemistry teacher, just so you can get your hands trained and understand the methodology, even if you don't understand the theory just yet.
How competitive is it to get internships in those kinds of spaces?
It can be competitive, but they have a strong desire for minority students. So they always making space. They always have dollars for minority students because they're trying to increase the number of us in STEM. So you can always probably find a space, but I think the most important thing is, you have to have like a GPA, you have to have the drive, because they just don't want to put you in a spot just because you're Black. They don't want to just put you there because you're Black, because you can get in that space and you get the check, and I ain't coming to lab tomorrow. I ain't coming, they got to see some type of dedication, because I've seen that happen too. You give people opportunities, you put dollars, you put your name behind people, and sometimes they don't follow through. So you just want to make sure, that's what you really want to do, because it's definitely a lot of scientists, they're very flattered when a student reaches out to them and interested in their work and interested in working with them, especially when you a student. It's probably an ego thing. It's a young person is flattered about what you do. Right. So they're glad to bring you in under their wing. So I think it would be relatively easy if a student were to put themselves out there, get some professors to write references, speak on their behalf. They definitely find space for you.
Okay, the HBCU thing has become a whole big issue just in general. Mm-hmm. So I'm going to ask you, because I went to a lot of PWIs, I didn't attend any HBCUs. Mm-hmm. Were there resources on campus that helped you get into this space, or was it primarily pretty much all you and you had more book knowledge from Voorhees?
It was both, because at HBCU, with my experience, a lot of my professors were African American, and they knew where to get these dollars from. They knew where to get these minority dollars from, because sometimes the federal government would approach them. Hey, do you have any students who would fit into this program? I mean, when you say fit in this program, I mean, it could be GPA. Do they have the background? Do they have the interest? So if you have a student that have the grades, that has the desire, you can have, okay, try to go for this internship, and they would make a way. I have known students that went to PWIs, colleagues of mine now, they really didn't do many internships, because when they got federal dollars, they went to the students in their department, highest GPA, and a lot of them didn't look like us. Say, for instance, UCLA. Okay, it's a lot of Black people go to UCLA, but it's more white people go to UCLA, other nationalities. So if you got a 4.0 and say a Caucasian person got a 4.0, who's going to get the internship? I mean, maybe you might get it, maybe, but when you go to HBCU, you're more likely definitely to get a spot, because if you have a 4.0 at a HBCU, they're going to push for you to get a spot. They're not really pushing for you. I can't speak for all PWIs, because that wouldn't be right, but a lot of times, they're not pushing for you like that. You know what I'm saying? I mean, I went to Georgetown University. It's a whole nother world. It's a whole nother world than going to HBCU. It's a whole nother world.
Actually, okay, so let's stay there. So, because that would be my next question. What does this space look like demographically? Are you typically the only Black person or the only Black female? What does that look like?
I was the only Black person in my program. It was one other minority female, and she was from Puerto Rico. She was Puerto Rican, and she actually graduated from Hampton University. She went to HBCU, and she was there, and it was rough. It was very stressful. It's a lot of times you have your counterparts, you go to class, maybe they don't come to class on Monday, you go to class, they want your notes. You're like, oh, cool, here you go, these notes. If you miss class, I don't have any notes. I can't help you. Oh, wow. You on your own. It's like they just throw you out in the water, and you have to swim. You have to find your way. It's a different world. It's a different world. So, a lot of people advocate for it. I've done both. So I've seen both sides. I've been to HBCU and I've been to PWI. I've been to both. Donald Trump kids went to Georgetown. Bill Clinton kids went to Georgetown.
It's a prestigious school.
Yeah, it's a whole different world there. It's a whole different beast. I mean, you might see anybody walking around the halls. I mean, I've seen Bob Barker at Georgetown, because he had, I think, prostate cancer. He was there getting treatment. Wow. Chrissy from Three's Company, Three's Company, that old show, Chrissy from Three's Company, she was there. She had breast cancer. She was there getting treatment. So you'll see anybody walking around there, anybody, Wow. At any time. Yeah.
All right, so let's get into what you actually do. So what is a research scientist?
A research scientist is someone that does research in a specialty field. Like for me, my field specifically is breast and ovarian cancer. And I look at it on a molecular genetic level. I look at it on a molecular, I look at the genetics of breast cancer, genetics of ovarian cancer. You're looking at it on a molecular level. So that's what I do. I study it, looking at the genetics, like how did this breast cancer, this specific breast cancer develop? How did the genetics have anything to do with it? Was anything to do with the family history, anything genetically? So I studied that side of it.
Okay. Let's look at some statistics, because I know you got some. So what are some statistics about ovarian cancer? It's as it pertains to minorities.
Okay. The statistics when it comes to
but just in general, because I know you probably have both.
Okay. When it comes to ovarian cancer for minority women versus, I just have to say versus Caucasian women, they actually are diagnosed more often. They are diagnosed more often. White women are diagnosed more often. We die more frequently. So if you have 100 people, you may have, say, 30 people white that has ovarian cancer, 20 people Black have ovarian cancer. It's more of them. So it may be 18 of us die out of 20, and it's 30 of them, and it may be 10 die of them.
So let me ask you this: is that because of not having a primary caregiver that you're seeing constantly, or just because the duty of care is lower for African American women?
You know what? In my opinion, I believe it could be biological, because I don't necessarily think it's where in the area I am. It's no such thing as like Black people have insurance where I am. They have insurance, they have jobs. There's a lot of educated Black. That's not the case, and they're still getting diagnosed with breast and ovarian cancer at alarming rates. I have a colleague at Howard University. She is an oncologist. She is a breast cancer surgeon and was diagnosed with stage 3 breast cancer. So She understands the dynamics of it. She has bona fide health insurance. She has the income. So it's not a low income thing. It's not a lack of education. Sometimes it's biological. And we as African Americans, we don't participate in clinical trials. So when you do take any type of chemotherapy or drugs, those drugs, they have to do some type of trial run. They have tested those drugs on Caucasian women, because a lot of Black people, they don't want to do.
You get thanks to Tuskegee Airmen for that one. That whole syphilis thing, now people are kind of sketchy.
So, exactly. So when they give you any type of medications or drugs, they're giving it to you based on how they function in that population of people. So we take the same drug they do. You understand what I'm saying? So sometimes it can be biological.
I never made that correlation, because you hear about trial studies and things, especially on Facebook. I see it. Well, we're looking for such and such, but I never would have put that together that makes that much of a difference.
Right. You don't know how to treat how do we treat our community, how we treat our people, how do we respond to breast cancer, different drugs? How do we respond? It's not enough of us participating, because a lot of us are terrified. Terrified that but I always try to encourage them, look at the programs, look at the clinical trials, because we are at the table now. Back in the day, they wouldn't have let us at the table. True. See, you know what I'm saying? We're sitting at the table now. We know what's going on, because I participate in trials. I've never had cancer, but they want to know anything they want to know. I have a history in my family. So I always give them data, whatever I can participate in, so they can come up with better therapies for us and my community, So if you can participate, if you're not putting yourself in harm or anything, they just ask for data. Even if they just ask to draw blood, that's it. Just to look at numbers in your blood, give it to them, because you're an African American man. Give it to them so they can look at it and test it, because we don't let them touch us. You don't let them touch us. So, right.
So in the absence of test subjects that look like us, they just test on whoever they get in the trial study?
Who will participate? They'll run a trial study. Sometimes they'll run a trial study for 3 years, 5 years. I've known some studies did 10 and 15 years. They're running along, trying to get as much data as they can to come up with, some tangible findings, so they know how to move forward with certain things. But, no insurance, lack of primary care physicians, that's a small body of people. That's not, it is people in that, category, but it's more, it's biological. And I think we as scientists have to delve more into that and dig more into looking at the biological aspect of it, because we can't just write everything off, or they don't have insurance, or they don't have, I know numerous people who have money, education, and insurance, and they dying just like people who live in the projects.
I did not expect you to say. You just kind of threw me completely off, because I thought by sure, because that's always the argument, is that the duty of care is lower for African-American women. And in essence, that's why they're catching their diagnoses later, because they're not coming in. So to hear you say that that's not it, or that's a very small portion of it. So in the grander picture, what does the grander picture look like? If that's a small part, and we're talking about genetics, how do you change that kind of stuff? Like, what can we do?
I mean, we have to have more information. You have to, I mean, how do you treat? If you don't have any data to even know how to treat someone with our biological makeup, then also, even if you do have women that are very proactive with their health, like myself, you know, my gynecologist, I went with him to Georgetown. I know him. So anything I tell him to do to me, test this, whatever, he's going to do it because we're friends. You know what I'm saying? But sometimes we as women, sometimes doctors don't take us seriously when we say we have an issue. Or you're fine. You know, I was talking this morning to this young girl. She 24 years old, and she just got diagnosed with breast cancer. And she was like, she was having like a blood discharge, and she kept saying something different. Oh no, your breast cancer, your ducts in your breast, like that makes breast tissue, make milk. She don't have any kids, but it was clogged up. That's why I was doing it. So it was going on and on and on and on. Long story short, this girl has breast cancer because what they do, they don't want to. It's so rare in somebody that's 24 years old. So they're not ruling it out. They're not. No, we're not looking at that. They wait till you have all these issues, then they go back. My philosophy is, I think you need to start to the top and rule down. You need to rule cancer out first and then go down, you know. So yeah, she's 24 years old. She's battling breast cancer now. And she's been having issues. It was like, you didn't want to give her a mammogram, just saying, oh, it's just like some cyst, it's this, sending her home, and you know, it just prolonged. So sometimes they don't take our complaints seriously, or they don't act on them.
So I guess that's the question. So in that situation, what can you do? Do you like go to you can't go to a specialist because we don't know science like that. So what do you do in a situation like that?
I would get another opinion. I would go someplace else. I would get another opinion. I would go to another doctor, because you have to have a doctor that you have that. But everybody don't have that relationship with their physician, and I understand that. But you have to find a doctor that you have a relationship with. They take you seriously with what you're saying, you know. Like for me, I don't have, you know, I've never had cancer before, but, you know, I do have a family history of breast cancer and ovarian cancer. My grandmother died from ovarian cancer. So, you know, I always want to be tested. Because, you know, when you get a certain age, you know, I've always been very skinny all my life. So when I started gaining some type of weight, I thought something was wrong. I'm like, what's wrong with me or whatever? And I told my doctor, I was like, something's wrong. I think you need to do a biopsy. My stomach is getting, I don't know, do a biopsy. Oh, Coletta, you fine. You don't need a biopsy. Well, just flatter me. All right. So he did the biopsy. He did the biopsy anyway. Of course, I was fine. There was no cancer or anything like that. He was like, you just need to lose some weight. You need to lose some weight. That's the issue. There's nothing there. I was like, okay, well, flatter me, you know.
It's like, I just want to be sure, like, exactly. All my life, like, how that work?
Right. So you just have to, you know, have a doctor that's be willing to do that. And if you have a doctor and you keep getting a lot of kickback and a lot of resistance from him, that's not the doctor for you. You know, that's not the doctor for you.
All right, so let's get into ovarian cancer. So what exactly, and you can use your big science words if you want. You got to break it down afterwards, but you can use your big science terminology if you want to. So what exactly is ovarian cancer?
Ovarian cancer is really a basic concept of just cancer in your ovaries. They actually start in the fallopian tubes. A lot of people seem to think they start in the ovary itself, but you know, the ovaries are attached to your fallopian tubes, ovary at the end. So the cancer itself develops in the fallopian tube, and it's the ovaries are very small. They're about the size of an almond. Like an almond is very small. So a lot of times when people develop ovarian cancer, they don't know they have ovarian cancer until in stage 3 or 4. Your ovaries sit very deep behind your pelvis and your pelvis wall. So in order for you to detect that it's a lump inside of you, the ovary, the tumor has to almost be the size of a grapefruit or a soccer ball for it to start to protruding outside, because it's not going to protrude. It's so far back. And if you look at the front of your stomach to your back and you see all that space, so in order for it to protrude to the front of your stomach, because it's all the way to the back, it has to be very large, you know. So in order for, a lot of times when they catch ovarian cancer in stage 1 or 2, I've known patients, they were like, oh, I had an appointment to get my appendix removed. And when I got my appendix removed, they found this little tiny spot, because they never really find ovarian cancer in stage 1, because there is no testing. There is no screening for ovarian cancer. Like breast is an outer organ. It's an outer organ, and we have screening. You can feel your breast. You can't feel your ovaries. You can't reach in there and feel them. So you would need some type of screening, and we do not have a screening in place. So what you would have to do is be more attentive about symptoms, like the symptoms you're starting to have. If your symptoms are off and you see you gaining some weight, or for a woman, if your cycle is all thrown off and acting weird, you need to follow up on that and find out why. Because that disease is ovarian cancer is fast growing and it's very deadly. It grows fast. It's like wildfire.
So that's okay. So let's stick with symptoms. So I know you named some of them. So what are symptoms that a woman should be looking for or kind of cognizant of that may lead to ovarian cancer?
Okay. Well, with ovarian cancer, it just like the different symptoms it has, it mimics stuff like UTI. The symptoms are so similar to something, irritable bowel syndrome. You know, you can be bloated. You can have to urinate frequently. Abdominal pain. It's just like it's something that you can confuse with something else. So the thing is, when you go and you see, anytime you go to the doctor and you think you have a UTI, it could be confused with that. You go get a UTI, they give you medication, you still have the same issue. Okay, that's 2 weeks in. You go back and they say, well, maybe it's irritable bowel syndrome. Okay, 2 weeks. So if you're having the same issue and you've taken medication beyond 2 to 3 weeks, you got to bump it up to the next thing. Okay, this is not what it is, because you shouldn't have to be on medication for months. Because if it hadn't helped in 2 weeks, you've been on a regimen for 2 weeks, then it's time to look at something else, especially when something as basic as a UTI. A UTI should be cleared up in 3 to 5 days. You know, irritable bowel syndrome. It just take long to clear that up as well. So when you rule these things out, you having this ongoing issue, and then also it's important to know your family history. If you know even if you have a family history of breast cancer, breast and ovarian cancer is 2 sister diseases. It's 2 sister diseases. My grandmother had ovarian cancer, her mother had breast cancer.
Oh,
right. It's 2 sister diseases. So even if you have a history of breast cancer, you still can develop ovarian cancer, and that's what I want my community to understand about the disease. You know, I want them to understand it, because it's far too many people getting this disease. They were like, what is this? They lost. I mean, you hear about breast cancer all the time, but ovarian cancer is closely connected. They share the same genetic mutations, BRCA1, BRCA2. When you have those mutations in your body, it can turn cancer cells on, just like a light switch. You know, when you say mutations, it's just like if you have like electricity in your house and say the lighting is faulty. It's the same thing. It's not working properly. It's not. And when it's not working properly, your cells are not, they mutate. It's a problem. It's like, I try to explain it so people can understand. It's like a cell in the car when the battery is dead. You know, one cell is dead and it's like clicking, this is like that.
Yeah, and they won't actually start because
right. The cells are not produced. They're supposed to refilter back normal. We have cell development every day. Every day we have cell death occurs and you rebuild new cells while you sleep. Cell development happens while you sleep, but they're not redeveloping. They're not like regenerating themselves. When they don't, they get faulty. When they get faulty, it turns to mutations. Mutations turns into cancer. That's what happens.
That was, that was gonna be my next question. I was like, since I got a researcher here, like, how does cancer even start? Like, but that's
mutations. The cells are mutated and they don't do cell repair. I know you've probably heard of cell repair.
Yeah.
Cells are supposed to repair themselves every night. When you go to sleep, that's when apoptosis takes place, at night when you sleep. That's why they always say, oh, you should get sleep. You really should get sleep, because that's when cell repair occurs, at night when you sleep. So when your cells are not repairing themselves, they turn into something else. And then with cancer, I mean, breast cancer, even ovarian cancer, you can develop ovarian cancer. It's in your body for probably 18 months or 2 years before it can even be detected. It takes a long time, because you got one cancer cell, it has to develop and turn into another one. So by the time they turn into that, now, some person, they can have cancer maybe, I don't know, 5 or 6 months. That's a very fast cancer. Most cancers has been in somebody's body probably 18 months to 2 years before it's even detected, even if it's stage 1.
Jeez. So are we working on, is that some of the things that you guys are working on now, is finding screeners or some kind of detection device to be able to catch these things?
Yeah, we definitely trying hard to find detection for ovarian cancer. Of course, we got the mammogram in place. We got a digital mammogram now, so that's even better than your standard mammogram. So you can actually see the breast tissue a little bit more clearly. But yeah, but right now, even when it comes to breast and ovarian cancer, people are because of science, people are living longer. I mean, right now we got 3.8 million breast cancer survivors in the United States. You know, once upon a time, breast cancer was a death sentence. You get breast cancer, you're gonna die. But now, breast cancer, it's almost like people living with diabetes. They live a long time. You know, I know somebody who the breast cancer survived 45 years.
Wow.
45 years. So if she died, it won't be from breast cancer. It'll just be old age. She won't, that won't be the reason she died. You see what I'm saying? So people are living longer. We have not come up with a cure, but we definitely are trying to reduce it, like the reoccurrence. People can live a longer, healthy lives and get back to their lives. So we definitely have made strides when it came to that.
Okay. So what are some things, because I know you're a community advocate. So what are some of the things that you tell when you're like in a community setting? What are some of the things that you tell people that they may not know?
You know,
about this?
Yeah, I know, but you would think they would know like things that we would think would be very basic. Oh, you make sure you get your mammogram. Oh, make sure. Yeah, you should, because when by the time you turn 40 years old, you can't be skipping your mammograms after 40. But you don't start till you 40, but between 40 and 50 and 50 and 60, your hormones and your cancer cells don't mix. Your hormones are, when you turn 40, 45, 50, your hormones are all over the place. You know, women might be going through menopause, premenopausal, all kind of stuff like that. When that happens, your hormones are not acting right. And your cells, they don't, you're more prone to being able to develop breast cancer when your hormones aren't balanced. And when you go through why you see women maybe in their 50s getting diagnosed, 60s getting diagnosed, it's like it's a hormonal thing. So if you can kind of keep it balanced, keep your hormones balanced, you should definitely not miss mammograms during that time period. You want to pay close attention. So if anything that's off, you can just get on it like immediately. And you would think that people should know to get a mammogram. I know a lady, I mean, she lost her mom, 2 sisters, and an aunt to breast cancer and never had a mammogram in her life.
Seriously?
Like, right, you that's what me and you think the same way, but for her, she's like, you know, she didn't, you know, but after I had a conversation with her, I mean, I had called some friends and ended up getting her like a mammogram for free, making sure she started going and stuff. But you would be surprised at people that don't even do the basics. Do not.
Jeez. Okay. So what does a day in the life look like for you? Like you go in the lab and get your little Peachtree dishes and like, what does a day in the life look like for you?
Oh boy, a day in the life look like to me. Well, you know, lately COVID is pretty much taking over everything. So, you know, I work for Merck Pharmaceuticals. So now, you know, we have to get in where we fit in to help that, you know, issue, you know, a little bit. But when it comes to cancer, it depends on, like, if I'm working on a specific project, you working on parts of that project, because I work on drug development, right? So I'm working on different medicinal compounds. I could have ovarian cancer in a petri dish, just like you said. I'll grow my cancer up. I want it to be robust. I want it to be thriving. I want it to grow fast. So I know this is some strong cancer. So when I get it in this petri dish, you know, I have all these medicinal compounds I'm thinking that will work to eradicate this cancer. So I use these little things that I put together, and I just drop it in the petri dish and see how it responds, how the cancer responds to the compound that I developed. So you to see how it responds at 2 hours, 4 hours, 18 hours, 24 hours, 7 days, 8 days. So over a period of time, you want to see how the drug is working on this cancer. So if it's doing well, the next thing I do is I will use mice. I will put ovarian cancer with a needle. I'll put it inside the mice. You put it in the mice. So I want to make sure, and you want to inject the mice, let the mice sit for a while, make sure it has the tumors. So once the tumors develop inside the mice, then I'll inject it with my medicinal compounds, because I want to shrink those tumors. I want to make sure those tumors are shrinking and doing what it's supposed to do. So then if that works fine, it's over a period of time. You don't do that in a day or two. That is a long period of time. You do that. Yeah. It's a whole lot of testing, a whole lot of data that has to take place. Then you go to another organism. It could be guinea pig or something like that. Then once you do all those things, then you might want to send it to the FDA, the Food and Drug Administration, to see if you can get this to be passed, or this can be used, or, you know, in some type of treatment, you know, or it'll be a contribution to something else. It won't be like, oh, I made this drug. It'll be a contribution to something that's already a larger entity. That's what it would be.
That actually sounds kind of interesting. Also, it's like you have to have a lot of patience to do that on a day-to-day basis.
Yeah, because I can go and you can do lab work anytime. I can go in the lab at 5 a.m. I can be done at 11 or 12 o'clock. It doesn't matter. Just get the job done. You know, you can't, it's not like I got to do it from 9 to 5. No.
Okay. Mm-hmm. What are some of your biggest accomplishments in this field? You personally, like what are some of your milestones that you look back and like, wow, I actually had a hand in, or I did that?
Mm-hmm. I think for me, to be honest with you, I think when I wrote my book about breast and ovarian cancer, I think it was a big accomplishment for me because I was able to translate everything that I learned, that what I was doing, back to my community in a language that they could understand. Because see, my book is not wordy like that, because I understand I'm talking to my community. They don't want to hear about all the molecular genetics. They want to know, how can I live? How can I not die? You understand what I'm saying? So when I was able to write that book, and it was a tangible tool for my community, and it picked up and it went crazy. It sold, and it still sells very, very well. You know, it's in Barnes and Nobles. I mean, it sold well overseas. That meant a lot to me because I know people were really getting something out of it. You know, they were really getting something out of it. It was something they can tangible, they can pick up. It's a resource. They can look. They can even look at how to live life after cancer. You know, how to get back to a new normal. You know, after you went through cancer. You know, so yeah, I think for me that was my biggest accomplishment.
You got a book laying around there somewhere you can hold up so they can see what it looked like? I know you do. You better, Niche, you better have a book around.
I do have a book. This is the book right here. Cancer Doesn't Always Win: A Comprehensive Guide to Beating Breast and Ovarian Cancer. So
all right, buddy, y'all see the cover right there. And I'm probably I'll put the link on it under the video so that people can get it. And just a brief, I know you kind of went into, but what's a brief synopsis about the book? Like,
okay. A brief synopsis about the book. In the very beginning of the book, I just talk about myself, how I got into science, and I just pretty much told them how I, lost my grandmother, how I have a family history. So pretty much told them my journey through my education, and then I talk about the basics. What is breast cancer? What is ovarian cancer? How breast cancer impact men? How you can protect your kids from breast and ovarian cancer at a young age. Life after cancer. I mean, foods you should eat, that were prevention, that would assist with prevention. All these good things, all those good things. So yeah, it's a lot of, it's a power pack in a small thing, because I don't want to overwhelm people. I don't want to be too wordy, and I definitely don't want to be scientific. Because when I first started speaking, people would call me to speak at different hospitals, Kaiser Permanente. When I would get there, I had this big PowerPoint presentation and this big slide, and they'd be looking like, what? I was like, just turn it off. I told them to turn it off, and I just started talking from the cup and explaining to them that I was talking to survivors. These people want to know how they're going to live. They'll leave the science to me. They leave the science to us. Come back and tell me what I need to do to live, and that's what I do. So.
All right, interesting thing. So the foods, what are some foods that prevent, I'm curious, what are some foods that prevent, this kind of stuff?
It's almost like this healthy food. This don't eat, like, for instance, like cigarettes. Believe it or not, alcohol consumption for women, alcohol increase the risk of breast cancer. I don't want to spit out the wrong number because I haven't even looked at the statistics on alcohol in a minute, but it's alcohol consumption. When you drink alcohol, it increases your risk for developing breast cancer. Milk, even when you drink milk, like cow milk, it's got hormones and it's hormonal. Especially with, young kids, like young girls. You see how young girls, when they're young, they start developing breasts and stuff so at such a young age. So the stuff that's got all kind of like hormones and stuff in it. So when you pushing them at their body at that age, you pushing them through puberty and stuff, because like if a young girl, she start having her cycle. I mean, I've known some kids 5 and 6 years old, like it's absurd having a cycle.
Seriously?
That's not good. That's not normal. It's not good to have a cycle that early because you're ovulating. Your ovaries are constantly working. Every 30 days you have a cycle. Every 30 days. It does that to you like 50 something years old. So you're gonna do that from you 5 until you 50. Your ovaries get worn out and they'll get faulty. It's like anything else. After over time, that's why when you get pregnant, it's good to get pregnant, like with ovaries. The more you get pregnant, your ovaries stop. You're not ovulating. Like they say, oh, I think I'm pregnant. I missed my cycle. Because it stops. You know what I'm saying? It stops, so it's not working. It's not working, so it's paused. So every time you get pregnant, you will pause for maybe 10 months, like almost 10 months or something. That's pause. So people who got 5 kids, they pretty much pause, they cycle for 5 years. So that's like stop, like your ovaries are in a resting state when you're like that. So if you never have kids, like women that don't have kids, they have a higher risk of developing ovarian cancer.
Really?
Yes. If you have no kids, for women that have no kids, because you've been having a cycle, maybe not 5. Most women, I like, for me, I was a late bloomer. I was like 13. I was a late bloomer, which is good, right? Late bloomer. But some people like 9, 10, 11. So you're talking about ovulating from the time you 10 to you 55 and never had kids. I mean, you never missed a set for 55 years. Your ovaries get faulty like anything else.
Wow.
But like anything else. So they always encourage you, even like when you breastfeed, like if you breastfeed, it pauses your cycle. Back in the day, when our great grandparents and stuff had all them kids and stuff, you would see them have a gap in kids. The gap wouldn't be no more about 2 years because they breastfeed for 2 years. And once they stop breastfeeding, when they went on a birth control pill, here they come again. Here they come again with another baby. So as long as they breastfeeding, you're not going to get pregnant because you're not ovulating.
Wow. My married female friends are not going to like you right now. They don't have kids. They don't have kids. They're not going to like you right now.
but if they on birth control pill, they take birth control pill for maybe like at least 2 years, 2 to 3 years, maybe not consecutively, but at any point in their life, because birth control pills manipulate your cycle too. It manipulates it. If you ever saw the pills, they got this color, green, purple, red, all the different color pills. When you get to a certain pill, that turns your cycle on. By the time you get to a next pill, it'll turn your cycle off. So what it does is manipulate your cycle. That's what it does. So you can't get pregnant. So if you've been on birth control pills for 2 to 3 years, don't have to be consecutively, in your life, that will reduce your risk for developing ovarian cancer.
You're throwing out a lot of little things that I never even, I'm not prone to, but right. Okay. So what I've gathered is pregnancy and birth control help lower your chances. Yes. Sleep is vital so that the cells can regenerate. Are we talking about like 8 hours or just sleep in general?
Just sleep in general. It's like, because that's when it occurs. Apoptosis occurs when you're sleeping. So you want to sleep overnight. So 8 hours, the more sleep, the better, of course, but yeah, just sleep.
There are certain foods that also help lower the chances. Okay. Anything I missed? Anything else you need to throw in there that lower chances?
I don't know. Let me see.
So we said sleep, pregnancy, breastfeeding, certain foods.
Exercise. Do not, reduce your intake of alcohol. Don't smoke cigarettes. Alcohol consumption, I'm telling you, it will definitely increase the risk of breast cancer for sure. It's
cigarettes too?
Oh yeah, cigarette impact everything. Every type of cancer, every type of ailment. Cigarettes is like the devil. The devil.
Okay. All right. Let me see. Was that all my questions? You did so good. I learned a bunch of stuff today. And I don't even have ovaries, but I learned a bunch of stuff today. Any final thoughts that you want to leave with people who are listening?
Yeah, just always be proactive with your health. If something is not right, if it doesn't feel right, if your gut doesn't feel right, move forward, talk to your primary care physician, because no one knows your body better than you know your body. No one knows your body better than you do. If something doesn't feel right, I don't care if like, oh, I'm too young for this, or that's impossible. It could very well be possible, So just definitely be proactive with your health. Do not ignore any type of signs you have. If you feel ill, if you have any type of pain or any symptoms for more than 2 weeks, go to a primary care physician and have them take a deeper look at what the issue could be.
Education wise, is there anything you would have done differently or anything you would recommend to particularly young Black girls or young Black boys that want to get into this field? Like a program that you discovered later in life or a different major that would have better prepared you? Any educational differences you would say?
Not really, but I think right now they even have more for African American right now. I'm even looking like at Tennessee State. They have a program that if you want to go to school to be a medical doctor, you can go there for free. Like no money. you just have to have the desire to go. Tennessee State, I know the president there. They looking for students. Now, granted, yeah, you do have to qualify. You can't go in there with a 2.0, but
Okay.
you can at least, like, if you have a desire and it's what you really want to do, HBCUs is gonna push you. They're gonna push you, and they got so many more programs out there now, especially with Kamala and in the house up the street. They got
from you.
Right, they got a lot of programs now. They got so much more, and it depends on the direction you want to go in. Like for me, I do bench research. Some people might want to see patients directly. Like for me, I don't see people directly. So if you want to see people directly, then you want to go and do an MD, and then you have to actually do like surgery and things of that sort. So it just depends on what direction you want to go in. But it's just like so much out there right now because they really pushing for minorities in STEM. And I mean, Howard University and Meharry University are producing more African-American MDs and PhDs in any institution in the United States. Meharry and Howard. Howard number 1, Meharry number 2.
All right. How do people get in touch with you?
I am on Instagram, and my handle is Coletta Orr. Facebook, Coletta Orr. Twitter, Coletta Orr. I have my website, www.colettaorr.com. You can email me at colettaorr.com. Everything is Coletta Orr. You definitely can reach me. You definitely can reach me.
So that I don't want to leave out. You have a family, so you have the balance. How old is your son now? He
just turned 12.
Really? How old is he? I thought he'd be older than that.
No, I didn't have my son when I was at Tommy.
That's right.
Yeah.
Oh, yeah. So what has that been like, juggling your home life with what you do? Especially with COVID.
Oh my goodness. Well, when COVID was going on, kids are at home. So, he was learning from home. So it was okay because what I would do, I would go in the lab on Wednesday, Thursday, and Friday. I would work from home on Monday and Tuesday. So what I would do on Monday and Tuesday, I would do all my data analysis. All the work I do during the week, I would crunch the numbers so I could come up and look at the numbers and see what's the next step I need to do when I'm in the lab. So that was helpful. It's a methodology day on Mondays and Tuesdays. Then I'm at the bench on Wednesday, Thursday, and Friday. So it kind of worked out. Yeah.
All right. So I want to say thank you to my hometown hero, Mrs. Coletta Orr. And I'm just excited. Like, I've learned a lot today. Like I said, I don't even have ovaries. And I learned a lot today that I can pass on to my sisters. I got 3 sisters and my mother and grandmother. So I definitely can pass this on. So I want to say thank you for coming on and sharing all this amazing information. In about an hour or so, it'll be on all the digital platforms. So I'm gonna put it on my iHeart, Spotify, all that good stuff, as well as the Facebook page. So you will see, and I'll tag you in it. But I'm so excited. Again, I appreciate you so much. Thank you. Definitely. So just hang on. I'm gonna stop the recording. And all right, buddy. I will see you guys later on Friday on the Leadership and Media Company page. We are talking with Dr. Dana Rickman and Dr. Robert Gaines, our annual guest from the Georgia Partnership for Excellence in Education. They'll be giving us the top 10 issues in education in Georgia. You don't want to miss it. Y'all know how they get down. I'm sitting on pins and needles to see what they came up with this year because they always have the good stuff. All right, so I will see you next time, same place, same time on the Blend Blazers podcast with your host, Ricardo D. Rice.